Iron is essential when you are pregnant or breastfeeding. It gives the mother energy and is vital for the baby's brain development and blood cell growth. It also helps treat and stop iron deficiency anemia. So eating iron-rich foods is very important for you and your baby's health during pregnancy. Heme-based or non-heme-based foods can be high in iron. Non-vegetarian foods with heme-based iron come from meat, while vegetarian foods with non-heme-based iron come from plants, vegetarian. You are not alone if you are pregnant and have been told you have low iron or iron deficiency anemia. Iron deficiency anemia is prevalent during pregnancy because a woman's body must do more work and her blood volume increases. Research shows that more than half of pregnant women don't get enough iron. This makes anemia in pregnancy a surprisingly common condition. But why is iron so important during pregnancy? How much iron should you get? What foods are good sources of iron? Here's all the information you need. Number 10. Super dark chocolate. Most milk chocolates have a lot of sugar, but super dark chocolate, 70% to 85% cacao, has less sugar and good nutrients like magnesium and iron. A 1-ounce piece of dark chocolate with 70% to 85% cacao has 3.37 milligrams of iron. Number 9. Red meat. Red meat has heme iron, which can only be found in animal products and is easy for your body to use. There are many kinds of red meat, but grass-fed beef has the most iron at 2.09 milligrams per 4-ounce serving. Number 8. Pumpkin seeds. Pumpkin seeds are an excellent choice if you're searching for an additional plant-based source of iron to add to your diet. The amount of iron in pumpkin seeds is 2.5 milligrams for a quarter of a cup. Number 7. Spinach. Folate is another essential ingredient for a healthy pregnancy, and spinach is loaded with all kinds of helpful vitamins and minerals. However, it is also an excellent supply of iron from plants. The amount of iron included in 1 cup of spinach is 0.813 milligrams. When sauteed or roasted, this leafy green cooks down quickly, making it simple to ingest more than you could otherwise. Number 6. Chicken liver. Iron is mainly found in organ meats like the liver and giblets. For example, 113 grams of chicken giblets have 6.1 milligrams of iron, making them an excellent source. The liver, on the other hand, has a lot of iron. Number 5. Oysters. Pregnant women should stay away from undercooked or raw fish, but oysters that have been cooked can be a great source of iron. 1 medium oyster has 2.56 milligrams of iron, so eating 6 oysters gives you more than half of the iron you need for the day. Number 4. Lentils. Beans, lentils, chickpeas, peas, and soybeans are all examples of legumes. However, there are many other species of legumes. They are an excellent source of iron, particularly for those who follow a vegetarian diet. There are 6.6 milligrams of iron in 1 cup, 198 grams of cooked lentils. Number 3. Beet. Iron is a crucial component of red blood cells. Beetroots contain many. If red blood cells lack sufficient iron, they cannot transport oxygen throughout the body. Iron deficiency anemia is a disorder that can develop in individuals who do not consume enough iron. Raw or cooked, a 100 grams opens in new tab. Serving of beets only has about 1 milligram of iron, but don't throw away the beet greens, which have almost 3 milligrams of iron per cup. Number 2. Sweet potatoes. Each half-cup serving of sweet potatoes contains 2.5 milligrams of iron. They also have high vitamin C content. Serve sweet potatoes as a side dish alongside lean meats like chicken, turkey, or steak to increase your child's daily iron consumption significantly. Number 1. Figs. Figs have a lot of iron, a mineral that helps keep hair healthy and strong. On the other hand, figs are full of iron, magnesium, vitamin A, and folate, which are suitable for you. If you eat a handful of dried figs, raisins, and 2 or 3 dates in the morning, you'll get instant energy and your hemoglobin levels will go up. When you're pregnant, should you take an iron supplement? During pregnancy, your doctor will check your iron levels often. If you don't have enough iron and they say you have pregnancy anemia, they may give you an iron supplement. You don't need to take iron supplements if your iron levels are normal. According to research, taking iron supplements as a precaution probably doesn't do much good. Instead, you should take a daily prenatal vitamin, consume iron-rich foods and foods that assist your body in absorbing iron, and follow your doctor's instructions. Why iron is important? Pregnant women have a well-balanced diet and pay special attention to their daily nutrient requirements. Folic acid and iron are 2 of the most important. When you are pregnant, your body needs twice as much iron as it does when you are not pregnant. That's because your body needs iron to make the extra red blood cells for the baby. Red blood cells provide oxygen to your organs and tissues, as well as to your fetus. Iron is needed throughout pregnancy, but the 2nd and 3rd trimesters are crucial. Since the body does not produce iron, it must be obtained from diet and supplements. Basics of iron. Foods with a lot of iron naturally can help prevent anemia and relieve the symptoms it can cause. Iron in supplements comes in different forms. One benefit of getting as much of your daily iron needs as possible from food is that food sources don't usually cause intestinal problems as some iron supplements can. Iron can be difficult to obtain from food alone. Cooking in cast iron can enhance the iron content of meals by up to 80%, and consuming non-heme iron-rich foods alongside a vitamin C source can aid the body in absorbing iron. Some things like a calcium supplement can also make it harder to absorb iron. If you take a calcium supplement, don't take it with a meal or snack high in iron. Tips: including at least one iron-rich food at each meal and snack is the easiest way to get more iron. Do you put iceberg lettuce in a salad? You could use baby spinach or a mix of leafy greens as the base and add white beans. Need a snack to get you through the afternoon? Beef and a handful of raspberries come to mind. Beans and lentils are cheap to get more iron in your meals and snacks. Several companies are making crisp baked beans that can be eaten like nuts. This can make it easier to include baked beans in snacks you eat on the go. You could also help yourself by adding a few prunes to your breakfast. Additionally, you may sprinkle prunes or raisins over your porridge or incorporate them into a trail mix. Eating bean burritos at least once every week is also recommended because they are inexpensive, simple, and healthy. Can too much iron be eaten? Iron supplements have more iron, which can harm your organs if you take them without first talking to your doctor or midwife. You can also overeat iron, so eating a healthy amount of red meat, vegetables, and iron-rich foods is essential. Some iron blockers can stop the body from taking in iron from plants. These can be found in tea, coffee, bran, and some drugs. Calcium-rich drinks can prevent the gut from absorbing iron, so it's vital to limit iron-blocking drinks when eating iron-rich foods. Hemochromatosis is a disease in which the body retains excessive amounts of iron. It can occur if the body contains too much iron. Consult your physician as soon as possible if you experience weakness, fatigue, or joint or abdominal pain. During pregnancy, the blood in your body goes up, which means you need more iron. Your body needs iron to produce more blood, giving your baby more oxygen. You could get iron deficiency anemia if you don't have enough iron or don't get enough iron during pregnancy. Iron deficiency anemia during pregnancy is also linked to having a baby with low birth weight and postpartum depression. Some studies also show that babies are likelier to die right before or after birth. So that's all for today's video. If you like this video, click the like and the bell buttons. We'll have another video for you soon. Take care until then.